Hi, everyone, and welcome to The Breakouts, a podcast where we interview extraordinary founders in just under 20 minutes. I'm your host, Akkshay Khoslaa. Now, you'll find many podcasts out there that are 2 to 3 hours long and interview these wildly successful founders after they've already made it big. But by that point, the founders are already 5, 10, or even 15 years into their journey, so their insights just aren't as actionable anymore. We're doing things a little bit different. We're interviewing founders that are on the cusp of breaking out so that you can learn the playbooks they're using to build category-defining companies today. And we're doing it in just under 20 minutes. Now, just before we get started, go ahead and follow us on Twitter at The Breakouts Pod, subscribe to this YouTube channel, and join our Discord community for aspiring founders. The link is in the description below. A real quick disclaimer right before we get started. This episode is one of the first few we recorded, so the audio and video quality isn't that great. We're working to improve it so that we can deliver a better podcast experience for you guys. But regardless, the insights in this episode and the entrepreneur that we interviewed are amazing, so definitely still go ahead and give it a listen. And I think that's everything I have for you. So without further ado, here's today's guest. All right, ladies and gentlemen, welcome back to another episode of The Breakouts. Today we have an awesome guest for you. His name is Nick Aubin, and he's the co-founder and CEO of Commons Clinic. Nick recently raised $11 million in seed funding for a startup in the health tech space, and he's with us today to share some of his insights along his journey of building his company. Nick, how are you doing today?
I am wonderful, Akkshay. Thank you so much for having me.
Awesome, Nick. I'm excited. Nick is going to be with us for 2 episodes. In this first episode, we're going to talk about the story behind his startup, how it works, and how Nick thinks about winning the industry. So to get us started, just in a few sentences, could you describe for us what your startup does and what problem you guys are trying to solve?
Yeah, it's pretty simple. At Commons Clinic, we are building the one medical or insert your favorite kind of consumer-first technology centric clinic concept for musculoskeletal care. So spine, orthopedics, interventional pain management, and physical therapy. We really see a big opportunity to go into a market like LA where we've launched, or San Francisco where we're going next, where you have these big oligopolistic hospital systems like Cedars-Sinai and Sutter that have really used the gravitational force of the hospital to consolidate markets and frankly just make specialty care really expensive and compete with them with a new care model that is brand first, that's built on lighter weight infrastructure, and we can offer a really high value, affordable care product to consumers.
Really cool. So it seems like you guys have honed in on one particular niche around spine injuries, knee injuries, shoulder injuries, anything musculoskeletal, right?
Yeah, exactly. I mean, when we say niche, though, we're really talking about like a $400 billion a year area of healthcare. Musculoskeletal care is like anywhere from like, depending on the population, like 15 to 25% of the overall spend. So it's massive. There's a tremendous amount of both low value care and avoidable care, right? And, we're really in the business of creating new value both for consumers and then lowering the cost of care nationally.
So it's a niche, but it's a very large niche. That's awesome because you can build a very focused offering, but there's also a massive opportunity to help people.
Yeah, I mean, I think it's like, people thought a lot of SaaS niches were niche, and it turns out they're massive, right? I think in healthcare, any area that you go into is pretty big.
Makes sense. What was your background? What were you doing before this startup, and what kind of led you to this journey?
Yeah, it's funny. So I grew up in Connecticut, went to school, a small little liberal arts school in Maine, and about 10 years ago, I found myself starting my career in LA. And funnily enough, as many people in LA do, started in the entertainment industry. Was building marketing plans for 20th Century Fox movie releases, and I was fortunate enough a couple years in to be interested to make the startup dive. I applied to a then stealth stage company on AngelList in the healthcare space, which became Heal, on-demand primary care house call platform. I really built my healthcare chops there. Built that company from 0 to 100,000 house calls the first couple of years. We raised a bunch of money, learned a lot, and along the way had a couple personal experiences with healthcare hitting me. One of my closest childhood friends passed away from glioblastoma, stage 4 brain cancer. My parents both had some musculoskeletal issues over the last decade, and really began to take this playbook that I've honed of building consumer-centric care models, and that led me to Commons.
That's so inspiring. So you were hit by these conditions and close friends and family, then you decided to do something about it.
Yeah, I mean, like, ultimately healthcare is like startup founder catnip. It's big, massive markets with incredibly big entrenched incumbents in a terrible experience, right? An opportunity to create a lot of new value, and it hits home. Like, everyone has had healthcare hit them, right? And so it's just so resonant, and it's kind of taken over my life.
Very cool. I'm curious about your personal journey here. Did you study anything related to healthcare in college? Did you think about ever going to medical school, or is this something that happened a little bit later?
I grew up as a upper middle class white kid in Connecticut, but I was fortunate. My dad owned small businesses, right? So we owned a couple small sign businesses, and growing up, I honestly hated working at them, but I did. But it instilled in me this entrepreneurialism that was just by osmosis. And I learned, what risk means to me is different from a lot of people. So always wanted to start a business. I was fortunate enough to fall into healthcare and first fell in love with the complexity of the problem. And then as my life progressed, as I became older, as healthcare hit me, it just became so apparent how important it was for me to, leverage that skill set and try to do something big. So that's kind of how I got here, and why I'm a healthcare lifer.
Very cool. I think it's going to be very interesting to learn from you, Nick, because if I think about some of the other guests that have come on the pod so far, a lot of them have started healthcare companies, in some cases with a spouse that's a doctor, or they've gone to med school first themselves and then gone about starting a healthcare company. And I think a lot of early stage entrepreneurs are interested in starting in healthcare, but a lot of the times they're like, well, I don't have like a medical background, so how do I kind of break into this? What's the right way? So I think there's going to be a lot of cool things to learn from you there.
Yeah, no, I mean, and like at the end of the day, healthcare is so broad and so deep. The folks that really succeed here both have a personal passion, and like that drives them, but they're also they're just sponges, and they learn so quickly because there is so much information. And so, if I were talking to that next kid who's 22 and deciding like whether they want to go work at the next, name your SaaS platform, or like go into healthcare, it's go do healthcare. If you want to work on big things, do things that you're intellectually curious about, but you have to be ready to like put in the work to learn as much as physically possible. Otherwise it's just too vast.
That makes sense. Let's talk a little bit more about your actual startup, right? I love your journey. It's a great journey. Can you walk us through the journey from the first time a prospective user learns about your platform all the way to value realization? What are kind of the steps along the way?
Yeah, so let's take a look at what happens today if you have low back pain, right? Low back pain is one of the most prevalent conditions in the country. Massive expenditure. And, you struggle for months or years, and, what are the options today? You are going to ask a friend, hey, how did you deal with this? Or you're going to go to your primary care physician and they're going to make a referral. Or frankly, you're going to end up on ZocDoc, right? You're going to say, hey, I need to go see,
right.
I need to go see a spine surgeon, right? And you're going to go in, you're going to meet a spine surgeon. And in the legacy environment, every incentive for that spine surgeon is to use the tool in their toolkit, which is surgery, right? Many of those surgeons are affiliated with a hospital, and you're going to end up, on this assembly line of care that passes you off. You get surgery, maybe a by-the-book referral to physical therapy, and you get to this the end of this yellow brick road of care with 15 bills from 5 different billing providers, and maybe you fixed your back pain, maybe you didn't. What Commons is designed to do is unite all of the clinical services that you need to solve your back pain under a single brand and service umbrella. So you come in, and whether you come from that referral from a friend, whether you come from learning about us direct to consumer, or whether your health plan or employer says, hey, go to Commons to deal with your back pain, you come into one of our modern brand first clinics, and there's an entire team focused on solving this problem for you, whether that is the operative path in surgery or whether we can prevent it with a virtual physical therapy program or anything in between. We are your one-stop shop. You come and all of your services are kind of architected in a very clear care journey, and we offer that to our patients for a single fixed price. All of your services are included, and really own the outcome.
That's really cool. I'm curious, what is your business model like? How do you price this entire service?
Yeah, so it's pretty simple. Let's take a total joint replacement, for example. You have knee arthritis. You need to get a new knee. I hope no one in our age group needs a new knee, but very prevalent. My dad had double hip replacements when he was 61, and what we do is from the moment you have your consult, all of the services for the next 120 days. So your surgery, the facility fee of that, the implant, physical therapy, everything is bundled into a single fixed fee. We then go to health plans like Anthem, Blue Shield of California, Cigna, Aetna, and we go sell those bundles. And we can save them a lot of money versus that care going to a higher cost hospital system with locked in guaranteed prices. And I can run that at a really compelling margin.
Very cool. And so you said you do partner with the insurance providers, right?
Yeah, exactly. Right. So the goal of Commons is to be as broadly accessible to as many people as possible, right? And to do that, you really need to be in network with health plans. We're currently launching in California and working on some really core, exciting relationships with the health plans in those markets, right? But at the end of the day, we're in the business of offering transparent pricing for really high value service to consumers who need musculoskeletal care. Health plans are a core partner to make that happen.
Gotcha. I'm taking a look at your website here on the pricing page, and I see, for example, it says there's a risk-free consultation. Initial consult is $500, right?
Yeah.
Now, is this $500 copay, or is this $500, that the insurance pays?
Yeah, it just depends on your benefits design, right? So that $500 would be covered by insurance. Maybe you owe copay, maybe you have a deductible. But we ultimately work hand in hand with insurance companies to make care as affordable as possible, right? And a big piece of this is if you went and got that spinal care at a large hospital system, it might be twice as expensive, right? And so we can really deliver much more affordable care, with a really tight consumer experience.
Gotcha. Is it safe to say that you guys adopt a fee-for-service model?
No, so it's the complete opposite of that. So we really, occupy this space of value-based care, right? So if you've seen public companies like Oak Street Health or Agilon, we're really using a similar business model where we work with health plans to manage their musculoskeletal spend overall, right? We take on the risk and responsibility for that budget. And we don't have the same incentives as fee-for-service, which, for your audience is really like, do more care to make more money. We're really in the business of saying, hey, you need a total joint replacement because you have knee arthritis. This is the best, intervention for you to get back on your feet, right? We can do that for a fixed cost, manage our budget, and have really compelling margins for the care that we deliver.
Very cool. And just so I understand the different touch points here of the care that you deliver, on one hand, there is a consultation with a doctor or surgeon. Then there's physical therapy to see if that can actually solve a lot of the problems. And the third is, hey, well, if you actually need to get surgery done, you actually have surgeons that can do that. Are there any other touch points that I'm missing here? For example, is there any kind of program that you run through an app, or is the software that you have mostly designed to just facilitate these communications?
All of the above. I think when you think about healthcare, you gotta think about it through the lens of Starbucks, right? Starbucks enables a novel financial experience and a novel booking and consumer experience, and then has ridiculous technology on the back end to manage their operations, right? So, our care model really has three core machines. The first is what we talked about first, modern brand first clinics that really deliver, that high level of service to our consumers and all of the services that they need, from the physician to physical therapy to pain management, all under one roof. Two is we have partnerships with surgery centers in our community where we establish basically the clear line at the airport, right? Co-branded experience where we can really dictate that consumer experience if you do need surgery. And then sitting on top of it, to your point, is our virtual clinic. So that's easy access to our physicians through telehealth. That's a lovely payment experience, scheduling, and then a key kind of piece of operating leverage in our model is virtual physical therapy. Really, whether you are coming to Commons for low back pain and we're trying to avoid surgery, or whether you just had an ACL reconstruction, like ultimately PT is a big piece of this, and we want to use technology and the magic of zero marginal cost to make that care accessible to folks in their everyday lives.
So the doctors and the PTs that work with you, do you hire them, or are you more just the platform that connects them, kind of like your Uber or your Lyft?
Yeah, no, this is a full vertically integrated model where our care teams are exclusive to us. We primarily work on finding, physicians that have thriving books of business that are portable, meaning, they come to the Commons umbrella, they bring that business to us, and we can kind of reformat their business model, right? If you think about it through the lens of some other startups, like we look a lot like maybe like a Compass in the real estate space, where they're really providing a better platform kind of for real estate agents and brokers to do their jobs enabled by technology. We're doing the same thing for physicians and all of the other kind of wonderful cast of characters that deliver musculoskeletal care.
Interesting. And I see you guys also have 2 locations here in LA. What happens at those locations? Are those like full-on clinics, or?
Oh yeah, those are full-on clinics where we have physicians, physical therapy, imaging, like the whole kit and caboodle.
Very cool. So when I think about this from a consumer, I'm like, wow, this is amazing. This is exactly what healthcare needs. I wish we had this for obviously this vertical and every other vertical, right? If you have a good consumer experience around healthcare, that's just so incredibly new these days and so incredibly valuable. What I'm curious about, though, is like when we take all of these different costs that you have, right? So, for example, costs of hiring physical therapists, of hiring surgeons and doctors, of the physical space in the clinic. How do you operate more as a software business with software margins compared to a hospital or a clinic, which have margins closer to services-based businesses, right? Like, what is the secret sauce here to run a more efficient operation?
Yeah, so I mean, it's really value-based care, right? And at a base level, if yesterday you did a service, you got paid a fee for it. You do another service, you get paid another fee for service, right? Tomorrow, what value-based care is say, hey, you have a patient population, we're going to give you a budget to manage that population. If you can, for example, prevent a surgery, right? Or maybe shift that site of service for that surgery from a higher cost hospital system to a surgery center, or any number of cost saving metrics, you can create margin, right? So for Commons, our ability to create really differentiated margins here is our ability to use our clinics in this care model to impact costs that are outside of our 4 walls, right? That's really both the value that we can create for the world and our monetization engine.
Really interesting. So would you say that this value-based care and these efficiencies that you drive through your clinics, is that kind of what you articulate as your competitive advantage, or is there something else?
Yeah, absolutely. Like the reality is in the markets that we're going into, market share lives with high-cost hospital systems. Like their incentive is to keep cases rolling through these big boxes that have $1 billion of debt on them, and they're going to use their market position to charge as much as possible, right? If I can counter-position them, deliver a high-value service at a lower cost, and steal market share, we win, right? And they can't really compete because what they would have to do is hurt their business to do so.
Very cool. I'm curious, when you think about the industry at large here, right? As a new entrant, how do you think about winning the industry? So winning the industry is, I think, a kind of a false goal in healthcare because it is so enormous, right? Healthcare is a trillion mini markets, right? And so you need to win battles, right? And so for us, I really think about, what is the repeatability about the core things about our model that matter, right? Can I continue to repeatedly, predictably recruit great physicians, and are there enough of them in the world, right? We believe that's a resounding yes, right?
is there enough spend in this market nationally that I can continue to move horizontally throughout the country, right, and launch new markets, right? And so to me, winning the market is having infinite growth opportunities, right? We hope to get to a point where we have a really meaningful, single double-digit market share of managing musculoskeletal spend, but the reality is to have a $1 billion revenue business, you need like 250 doctors, right? It's actually not that many, right? And so,
really?
Yeah, and I mean, when you think about like the amount of risk a single physician can bear, and so one kind of maybe piece of advice that I would push on your audience is like, think about your market as, is this zero sum? Some markets are zero sum. Some markets are going to have one winner, right? And in other markets, the question should be, do I have a scalable solution that can grow into an enormous market, right? And, is that market, almost by definition, infinite, right? Who would have thought maybe right around when like Jeff Bezos was starting Amazon that, that e-commerce would be infinite? Like he was building a bookstore, right? And that's an uncapped market, right? They obviously have massive market share, but e-commerce as a category, you can basically grow infinitely because it is the economy.
Interesting. Would you say that one way to look at this is even, imagine if you had a hospital exclusively for this specific vertical, and that hospital was able to be more efficient than every other hospital, and it was able to grow much faster, hire physicians faster, deliver better care, and be software enabled. Would that be one way of summing up what you're building here?
I would say that yes and no. So what I want to do is I want to own the physicians, own the case, and then own as little of the physical infrastructure as possible, right? That hospital, it still costs, 10, 15, $100 million to build, right? And, the beauty of how we're constructing things is we want to be as asset light as possible. We want to be able to bring on as many physicians, as much case volume, and ultimately as much, healthcare risk under management as possible. And, that's really, how we compete with a hospital, right? Like hospitals are ultimately bound by the physical infrastructure of a hospital, right? It's very expensive. Yeah.
So would you say the way to make the differentiation here is that in a hospital, you have all these different departments, whereas with your clinics, when you come in, that's basically where you're consulting with the doctors or the professionals that you have, but you don't have this burden of having all of the different equipment for surgery and care that you would have at a hospital. And instead, you take that part and you contract out with facilities that are top-notch. Is that one of the innovations here?
Yeah, nailed it. I mean, I think ultimately what we're trying to achieve is a more productive healthcare ecosystem for musculoskeletal care. So if today you're going to that big, expensive hospital, right? Tomorrow you're engaging with virtual care, right? You're having a physician-led experience. We're using more affordable sites of service in the surgery center, and really managing and allocating those resources is kind of the magic of the model economically. But from a consumer perspective, we try to meet folks where they are today. They don't want to go to hospitals. They want to engage virtually. They ultimately just want their back pain solved, right? And
right.
Our job is to solve it in the most efficient way possible and use technology as kind of a key enabler to manage all those resources.
I think that's really cool. I think we're going to see a trend here, health tech companies decoupling essentially the testing and procedure part of things from the consult part of things, because the consults, they can get done much sooner, they're asset light, et cetera. But the testing and procedure, that's really the heavy part. And as soon as you decouple those, there can be a lot of efficiencies that you can create.
Yes, sir. Yeah, I mean, I think like at the end of the day, it's about delivering the services that patients need and not the ones that they don't, right? It's as simple as
exactly.
that. So much of healthcare has been designed to make money in an antiquated system, and so we think that we can be the tip of the spear to really create a new model.
Awesome. I love it. All right. Well, we're right at time here, but just as we wrap up, I wanted to ask Nick, you've shared so many amazing insights with us today. Is there anything you'd like to plug on the pod? For example, if you're hiring, looking for customers, feel free.
Yeah, so if you live in LA, we are currently looking for some folks to join the team in BD and operations role. Easiest way to find us is go to commonsclinic.com, shoot us a line, and we're looking for talented, hungry folks that want to take down some of the big incumbents in LA and go to war.
There we go. All right, check these guys out at commonsclinic.com. Check out Nick as well. Nick, is there a place that our listeners can follow you? Twitter, LinkedIn, etc.
Oh man, I'm just a reply guy on Twitter. I gotta build my clout, but at Aubin on Twitter.
Awesome. There you heard it, folks. And I think that wraps up our episode. We'll see you next time on the breakouts for part 2 with Nick Aubin. All right, and that wraps up today's episode. We really hope you enjoyed it. Now, just before I let you go, I wanted to reiterate one thing. We're trying to build the best podcast out there for aspiring entrepreneurs, and to do that, we need your help. The best way you can help us is by joining our Discord community. The link is in the description below, and then leaving us feedback. Tell us how we did. Tell us how we can improve. We're eagerly waiting to hear from you. Other than that, show us some love and follow us on Twitter at The Breakouts Pod. And I think that's everything I have for you. We'll see you next time on The Breakouts.